Welcome to CAP's webinar on accommodating employees with degenerative disc disease. My name is Lauren Ernett, and with me today is Kimberly Evans.
Hello, everyone.
Today we are going to talk a little bit about degenerative disc disease and its symptoms, as well as assistive technology that could be beneficial for an individual experiencing symptoms associated with degenerative disc disease.
While degenerative disc disease is not actually a disease, it does refer to a condition in which pain is caused from a damaged disc. Discs are like shock absorbers between the bones of the spine and are designed to help the back stay flexible while resisting forces in different planes of motion. When we are born, a disc is about 80% water. As we age, the spinal discs begin to dry out, become thinner, and lose the ability to absorb shock, which can cause pinching or pressure. By the age of 50, most people have some degree of disc degeneration, though not everyone will experience back pain or be diagnosed with degenerative disc disease. Tiny tears or cracks in the outer layers of the disc allow the jelly-like material inside to be forced out, which can cause the disc to rupture or break in fragments. The inflammatory reaction that can result in back and neck pain when sitting, bending, lifting, and twisting is diagnosed as degenerative disc disease.
Symptoms vary from person to person. Some will experience severe pain, while others will experience none at all. Reaching up, bending over, or twisting can worsen existing pain. The location of the affected disc will determine where the pain is occurring. Pain in the neck can mean the affected disc is in the neck area. Pain in the lower back, buttock, or leg can mean the affected disc is in the lower back. Some will also experience numbness or tingling in the legs or arms.
A doctor determines degenerative disc disease by conducting an exam, performing diagnostic tests, and through a review of the patient's medical history. During the physical exam, the doctor will check the affected area's range of motion and any pain caused by that motion. They also look for areas of tenderness, numbness, tingling, changes in reflexes, or weakness in the affected area. The diagnostic tests could include an X-ray, MRI, CT scan, myelogram, and discography.
Now that we understand a little more about degenerative disc disease, its prevalence, and its symptoms, let's talk a little about assistive technologies for people with degenerative disc disease. Nerve and muscle pain, as well as spinal inflexibility, are some of the most common symptoms of degenerative disc disease. There are a number of assistive technology options that could be beneficial for an individual experiencing these symptoms. The kind of assistive technology that an individual will need will depend on the symptoms experienced and the activities that exacerbate the symptoms. Some individuals will experience back pain and others neck pain. Some individuals will experience overall muscle stiffness, and some can experience a combination of all of these things.
An individual experiencing back stiffness or pain could benefit from lumbar support. Lumbar support devices provide various levels of support in the best location on their back or pelvic area while working from a seated position. A device like this could help someone find and maintain a comfortable position while seated at their workstation.
For an individual who is experiencing neck stiffness and works with hard copy documents or files, a document holder could be beneficial. Document holders allow an individual to position hard copy documents in the best position based on their limitations and workstation setup. This could prevent them from having to look down at documents while simultaneously looking up at a computer screen, which could potentially aggravate existing symptoms.
If muscle stiffness has spread to the shoulders or arms, an individual could use an alternative pointing device and keyboard. These tools can prevent excessive straining, twisting, reaching, or gripping that could worsen muscle tension and stiffness. To use a standard pointing device or mouse, a person must reach laterally while moving their arm and wrist to control the mouse. This motion may exacerbate symptoms someone is experiencing. Alternative pointing device options may include trackball mice, which are like upside-down mice with an exposed protruding ball that the user can roll with their thumb, fingers, or the palm of their hand to control the mouse. Another device is a vertical mouse, which is similar to a standard mouse, but the buttons are on the side. These are designed to keep the user's hand in a natural position and can include joystick mice as well as other contoured designs. Lastly, there are devices where the cursor control is located in front of the keyboard. These devices are controlled using a rotating cylinder, mesh netting, or touchpad located directly below the spacebar. These mice eliminate lateral reaching completely.
Ergonomic keyboards allow an individual to adjust the tilt, angle, and support of the keyboard they use to perform computer-related duties. This would allow an individual to keep their arms, wrists, and hands in a natural position when keyboarding and could prevent the symptoms experienced. Many keyboards are built with adjustability in mind, and the selection of a keyboard is often based on the limitations an individual is experiencing.
There are also items that put the keyboard, pointing device, and monitors in the best position to eliminate symptoms potentially caused by degenerative disc disease. Additional ergonomic equipment may include keyboard trays, which can enable an individual to adjust the height and position of their keyboard. Other ergonomic equipment can include monitor arms or risers, which enable an individual to adjust the height and position of their monitors. This ensures they aren't craning their neck or moving their head unnecessarily when working on the computer. All of these devices provide more mobility and comfort to an individual that could be experiencing discomfort or pain occurring from stiff muscles or agitated discs. To help illustrate the point, we are going to go through 2 brief case studies to show how assistive technology can be used to accommodate someone experiencing symptoms related to degenerative disc disease.
A federal civilian employee who works for the Department of State was diagnosed with degenerative disc disease. As a result, the employee experiences pain in the neck and back throughout the day. This employee's primary job function is data entry, which involves taking data from hard copy documents and inputting them into an online database. Through a needs assessment, CAP learned that the employee's monitors were too low and non-adjustable. In addition, the hard copy documents the employee needed to reference were typically placed on the desk surface. To help the employee complete their primary job functions while reducing the pain that they experience throughout the day, CAP provided a monitor arm which allowed the employee to adjust the monitors to the correct height and tilt. In addition, CAP provided a document holder which allowed the employee to refer to hard copy documents without having to lean forward to look down to the desk surface to view the data. The reduction of repetitive movement between the hard copy documents and the monitors reduced the symptoms significantly.
A service member whose job required her to jump out of helicopters now works in the Pentagon. Her primary job functions include working on both classified and unclassified computer systems throughout the day, as well as participating in conference calls. This service member was diagnosed with degenerative disc disease. As a result, she experiences pain when seated throughout the day. Through a needs assessment, CAP learned that the classified and unclassified computers were required to be physically separated within her cubicle. This forced the service member to move between workstations throughout the day. To help her complete her primary job functions while reducing the pain that she was experiencing, CAP provided a number of tools, including a lumbar support for her chair to provide additional support when seated. In addition, the height of the desk was too high, forcing the service member to reach up to use the keyboard and mouse. So, CAP provided a keyboard tray for each computer system. This allowed the keyboard and mouse to be at the proper height. Finally, CAP provided a telephone headset, allowing her to speak on the phone without cradling the telephone handset between her ear and shoulder. This freed her hands up to allow her to speak on the phone while simultaneously taking notes on the computer.
So how can someone find more information about assistive technology that can accommodate an individual with degenerative disc disease? For more information, visit the CAP website at www.cap.mil. For questions, please call 703-614-8416 or email cap@mail.mil.
You can also follow us on Twitter through the handle @DoDCap. We are on Facebook at facebook.com/DoDCap, and you are welcome to view other webinars or technology demonstration videos on the CAP YouTube channel at www.youtube.com/thedodcap.